this is going to be a little different than yesterday, as you know. We're all going to, we're going to talk a lot amongst each other. But I am really excited to introduce this whole focus will be on communication among key players. You see, you're going to be able to work with pens and markers and sticky notes today. But first, we have this awesome panel and our awesome moderator, Shaz. So I'm going to introduce Shaz Damani. Shaz Damani, MPH, is a program research specialist at the New York State Department of Health, where she manages the National Wastewater Surveillance System. She earned her MPH from Emory University and specializes in infectious disease surveillance, wastewater-based epidemiology, and machine learning applications in environmental health. Her work focuses on creating scalable infrastructure for early detection of pathogens, especially in high-risk settings like mass gatherings. She is a co-author of a guidance document on using wastewater data for effective communication about infectious disease dynamics in communities, aiming to make public health data accessible and actionable, and that is why she is our moderator today. Take it away, Shaz.
Hi, y'all. How are y'all doing? Are we alive, awake, alert, enthusiastic? The camp counselor in me is coming out. So we have so many cool people on this panel. I've had the pleasure of getting to know each and every one of them, and we have somebody online as well, Spencer. They are one of the coolest beings I have met and gotten to know over the last couple of weeks. And I cannot do the great work that they do justice. So what we're gonna do this time around is we're gonna give each of them the spotlight and talk about some of the work that they're doing, and so you can understand where each of their perspectives are coming from. We'll start off with Gabriela from Colorado.
All right. And is the slide gonna appear?
I think so.
I can move them forward. You just have to let me.
Yeah.
Okay. All right. Yeah, we can go ahead and move forward.
Oh, yes. Housekeeping. Sorry. We're all professionals here. If you have not signed in, please go outside and sign yourself in. If you have questions, feel free to just raise your hand and we'll have that conversation. We'll just call on you and have that conversation. And I think that's pretty much it. Yeah. And digital agenda, the QR code is right there if you need to know what's happening. Mm-hmm. Next slide. Welcome to Communications, Key Players. I'm Shaz Damani. Next slide. Objective. Oh, we want to communicate. I feel like this is a pretty, we can keep rolling. Next slide. Yeah. And then these are our esteemed panelists. We're starting off with Gabriela, and then we'll go to Amanda, Amelia, and then Spencer is online. So the best for last, he's also Libra, like me. Oh. Not saying that the rest are not, but a little biased. Oh,
I guess I'm.
Amanda's going first. Yeah.
Hi, everybody. I'm Amanda Bidwell. I'm with WastewaterSCAN. I'm the scientific program manager. So I work really closely with Allie and Marlene over here in the corner. And so we can go to the next slide. So just an overview. I know Allie kind of gave a broad overview yesterday about WastewaterSCAN, but we are a national effort based out of Stanford. And we work with Marlene at Emory as well to build a national network using consistent methods. So we currently have 147 sites across the country in 40 states, and that represents about like 11 point, I think the next slide gets into it, like 11.8% of the population through our program. We work closely with Verily around logistics and laboratory analysis and data collection. We worked with National League of Cities when we started to build the capacity and do outreach through to individual cities and jurisdictions. And then our local partners are all of the people who send in samples and the public health agencies that use our data. And I believe you are one of them. So that's pretty exciting. So we have sites across the country. They send in samples 2 to 3 times a week, and we analyze them, and they are on our website within 48 hours of sample retrieval. Next slide. So here are our program goals. It was to build a national network across the country to advance the science. Since we are an academically led project, we do a lot of research projects across our network, and some of those we scale to include in our program. Also, I just mentioned, we conduct research, both in our individual labs and then in partnership with Fairly as well. Next slide. Next slide. So here's just a map of where we are at. I know I just briefly went over this. So 147 plants across 40 states, and the size of the bubble here indicates the population. So we have plants that range from 10,000 people all the way up to 4 million people here in LA. Next slide. This is all about communication and building trust, right? And so I just wanted to put several different ways that our program goes about that. And so we have a vast network of stakeholders in this project, not only our immediate partners, but members of the public, media agencies, other academics. And so we build our trust by communicating frequently with our partners. So we do monthly newsletters, we have monthly meetings, we do one-off meetings with our partners. We are also very transparent about what we do. We publish all of our protocols and methods online. We make them readily available for anybody who wants to find them. Attribution, we work really closely with our partners when we're doing research projects, and we make sure that everybody gets the buy-in into the process as well. Our methodology, Ali went into this extensively yesterday, so I'm not going to take the time now. And then we also publish most of our work through peer-reviewed journals, and we make that also available for everybody to see. Next slide. So here's just a high-level view of who our stakeholders are. So as I mentioned, we have our partners who are the people who are submitting samples to us and are the end users of the data. And then we work closely with both local and state public health agencies around translating those results into action. We work with the CDC News Network as well at the federal level. We partner with other academic and researchers across the country and across the world on different wastewater-based epidemiology projects. And then we work closely with communities. So we've really started to pivot into doing social media as an outreach recently to reach, general members of the public, other agencies who are interested in seeing what we're doing. Next slide. So here's just a brief example of some of the products we produce. So we do a monthly newsletter that is publicly available to everybody through our Ghost.io platform. Happy to share the links afterwards. We also create FAQs around how to interpret data. We create toolkits for social media outreach for our partners, specifically around respiratory virus season. And the last one is just an image from social media. Next one. We have external communication, so our website is used not only by our local partners, but members of the public, so I just included a screenshot there. We do interviews with the media to promote and advance the science and promote our partners. So just yesterday, Marlene a couple of days ago, gave an interview to Time Magazine around the measles release that we just did for data, and then we also publish our papers in open access journals as well. So I think that's all. I may have gone over my time, but high level overview to what we do at WastewaterSCAN.
Yeah, thank you. So you see, this is what you're going to be expecting from each of them on the work they're doing. So if you have any questions, start writing them down on that big piece of paper, sticky notes, and we'll get around to them as well. Our next person, Gabriela.
All right. So I just wanted to go over an overview of the program. Want to go to the next slide, please? So this is our program structure, and we're divided into two main sections, epidemiology and lab. And our epi section is further divided into communication and data. And we work with our wonderful lab team to efficiently process samples for 20 Sentinel sites. Next slide, please. So this schematic really highlights the Colorado Center of Excellence focus in building a strong wastewater response network. And we focus on meaningful engagement with our stakeholders as well as lab culture of innovation. And through all of this, communication is really key. So lately we've been doing community engagement meetings and focus groups that have been providing us feedback on things like visualizations for our dashboards. And these are members of the public and members of community action groups that have been, again, giving us feedback and letting us know in real time what they think of a new visualization. And we also, of course, communicate through monthly meetings, in-person visits, conferences. And we really prioritize accessibility collaboration with public and utility stakeholders. And there's a great joint support when it comes to coordination, lab, and data among all of our teams to really make sure that we're ensuring consistent communication and 360 approach when it comes to analysis and innovation. And next slide, please. So I kind of wanted to start with a perspective that I personally have and that our team has as well. And it reflects the recent work that we've been doing. So ethical and equitable engagement is really critical in public health projects. And engagement really heavily relies, of course, on communication. And really effective communication should focus on the relationships that you have with the people you're communicating with, rather than just the output. So instead of just focusing on what you need to get done together, it's like maybe just focus more on how what the other team is like, what their needs are, what their challenges are, what their successes are, instead of just focusing on that output. So yeah, part of the communication is really building a relationship and understanding a specific concern on that community. And next slide, please. So I wanted to introduce, again, my perspective and some of the principles that I use to guide my communication. So for the summit, and I presented a poster yesterday, and I'm in the process of publishing an article concerning Indigenous research methodology and the role it can play in community engagement, but also across public health. And Indigenous research methodologies are rooted in the Indigenous lived experience and traditional knowledge. And moreover, they focus on real life community concerns. And next slide, please. So these principles can act as a helpful guidance throughout the realm of public health and when doing the work of shifting the focus from output to relationship. So we have here, actually we can go ahead and go to the next slide. So we have here, these are principles of Indigenous research methodology, so it's not all encompassing of the methodology, but these are the ones I focus on in my article. And again, relationship, we already talked about that. Respect, acknowledging cultural norms, and again, this is more focusing on working in tribal communities, but I believe that this can be applied to all public health and across different communities as well. Responsibility, involving active participation in co-creation projects, working with the team you're or work with the community rather than telling them what to do, allowing yourself to be led by them. And representation as well as relevance, making sure that the community needs are aligned with your project, and reciprocity, so it's an equitable exchange of benefits and ideas. And that last one, tribal self-determination, refers again specifically to tribal communities, but it's important when recognizing tribal sovereignty and autonomy. And next slide. And that's it. That's my email if you want to reach out to me. Thank you.
Beautiful. They have a wealth of experience. So as you're seeing, we're seeing a shift, right? We went from a academic point of view who helps more of the general public, right, understand what's happening with trends, to more boots on the ground and working with our local communities, which brings us to Amelia.
I think we can go to the next slide. So a little bit about me and us at Laredo Public Health. I am from Laredo, Texas. I'm not sure if y'all are familiar where that is. Texas, it's right on the borders. It's next to the Rio Grande border with Mexico. So it's a little bit more unique, I guess, perspective from us, as we are the largest import of entry, inland port of entry. So we do see a lot of people, go through our community. Census, we're 205 residents, but I think we're closer to 300,000. So not that small, but we are mostly Hispanic. We're in the high 90s, so not a lot of diversity in our community. And because of our location, we are at higher risk for non-endemic infectious diseases. So we started wastewater surveillance back in March of 2021, in 2022. In 2021, I kind of heard about it, and I know our director was like, maybe it's something that we should do. And I think something very important is that he's really open to, new ideas and being innovative. I reached out to our local regional office for DSHS, which is Texas Department of State and Health Services, and they were like, no, there's no funding to do wastewater surveillance. So that was kind of like a roadblock, and I know a lot of people ask me this question, like, how did you start? So, but I was like, no, I mean, I see people enrolling, like, there must be something, right? So I kept asking and asking questions, because even, I know we're talking about communications and relationships, but even if you don't know the people, just reaching out to them, you can get, further. So the next step, I ended up contacting, back in the day, it was Lumen Ultra, I think the laboratory that had the contract with the National Wastewater Surveillance System. They're like, oh yeah, you can enroll. And I was like, that's not, you didn't tell me that at the region level. So I went directly with them and we got enrolled, and, brand new to wastewater surveillance. We had no idea what was going on. So we enrolled, our city has a total of 6 wastewater treatment plants, so we enrolled all of them. And we started to learn more a little bit about, wastewater. So then right now, up to this date, we're enrolled in the National Wastewater Surveillance System, WastewaterSCAN, high-risk substance monitoring with BioBot, also Texas Epidemic Public Health Institute, which is TEPI, and Wastewater-Based epidemiology. So how do we get to be enrolled with all of these, right? And we're severely underfunded. I mean, even medically underserved. So it's pretty much, word of mouth. I ended up somehow in another conference in Oklahoma. I met Anna, and from there, just building relationships, talking to people, and just asking questions. What programs are you enrolled? Can you give me any advice? But really, you just need to build that relationship and talk to other stakeholders, because that way you get to know more people. So that's how we got enrolled with all of these, and obviously, because this brings a huge benefit to our community. And so we have all the data, we have a bunch of partners, but what are we doing with the data? And the next slide. So, and that's very important, because you get the data, and as epidemiologists, you have to do some actionable data. So we do produce 2 weekly wastewater reports that are shared to our community in both English and Spanish, because like I said, we're predominantly Hispanic, so most of the people speak Spanish. We do health alerts within our community, because with wastewater, it does provide us an early warning of any pathogen or substances in this case, because we're enrolled in the high-risk substances. We also host monthly binational meetings. So we do have meetings with our partners, epidemiologists from Laredo, which is our sister city. And we do share those reports, including those on wastewater, because they unfortunately do not have wastewater surveillance, but since we're sister cities, what happens in one community, we will most likely see in the other one. So this is very important, our binational meetings, to share this. What are we doing with the data? So we get the data, we see, pathogens rising or getting lower. So we do targeted interventions like vaccine promotion and health education. So we have a group of people called program promotion specialists. They're kind of like community health workers. So we deploy them to certain, depending where we see those hotspots based on wastewater. So we use also the cases that we get reported to our health department in conjunction with wastewater surveillance, so we can do those targeted interventions. So we use a combination of methods of surveillance. And we have a mobile van, so it gets deployed, and we do vaccine drives. Let's say there was a rise in influenza, we do that, and we also do community education with them. So with our high-risk substances, we do also do harm reduction. So depending where we see those hotspots, okay, we've been seeing a rise in, in fentanyl. We use information from our 911 system, and also police department data and fire department data all together, so we can pinpoint those areas. And I know it was a concern that I've been asked, do people feel stigmatized because of the areas? Not really. It's interesting that our community hasn't been felt like, oh, this is like the bad area of Laredo where people do drugs. No, because I feel like the area that the wastewater plant covers is large, that they don't feel that, that there's like a breach in their privacy. So once we locate these neighborhoods, we've been doing an initiative that's a lot of people have been liking, we call it Knock and Talks. So we canvass around the area, and we do it in conjunction with animal care services, because there are some loose dogs sometimes in the area, so they help us with police and fire and health department personnel. So we visit, those neighborhoods and we talk to them about, the effects on overdoses, fentanyl, and how to administer Narcan. So we do provide Narcan when we do our talks, and also this information also lets us strategize where to put Narcan cabinets. So we do have them located around our community, so that way anyone can, if needed, they can get this free of cost. So we do this every now and then, and there's some pictures there. I think you can see of, some of our firefighters with public health staff doing those educational talks. And then also we've developed, and I know it's in the infancy stages, our overdose data dashboard. So that way the public can also know where these cabinets are located. And it also provides data on the type of overdoses that they've been seeing, and also any deaths. So, but it's not pinpointing any address. And then next slide, I have more pictures. So those are more pictures of our efforts with our Knock and Talk initiative. We also did one day, we just got together, I know, city council, fortunately, and that's also, I think, a big buy-in to have your city management, city council be for all of these initiatives, because they do help us. They do help us promote also. We did canvas on the streets. On a Friday evening, we stood there with posters, as you can see there, reminding people, not to, it's a Friday night, to be, safe and not use any drugs. And a lot of people actually went up to us and stopped and asked us questions about what is Narcan, how do you use it? And then they started asking us oh, because I have a sister, a brother, and what do I do? How can I help them? And we do have other resources. We do have a detoxification center where they can be referred to. So we give them those educational, talks. And actually, just to measure our initiatives have been working, we did see a reduction in the wastewater in regards to high-risk substances. And also when we do see a rise in flu, we also see the decrease and reduction in our wastewater once those initiatives are done, like immunization campaigns or just education in general. So it's very important to, get the data, but also do some actionable strategies, and it would all depend on your community. So it would be good to, for example, in ours, have both in English and Spanish newsletters that can be distributed, and also these types of strategies have worked well for us. So that's some of my actionable strategies and data for Laredo.
Thank you.
Thank you.
Amelia, that's incredible, right? So you're seeing how the impact really happens in real time. Sometimes we just put out a report into the world, we set it up the leadership chain. What happens after that? The overlords know what they want to do, where they want to put the money, and it is what it is. Which brings us to the people who are actually sampling, the utility partners, and that brings us to Spencer Sachs from PASA.
Good morning, everybody. I apologize for being virtual, but I appreciate you all, allowing me. So my name is Spencer Sachs. I am a legislative and regulatory advocate with the California Association of Sanitation Agencies. We represent over 140 public agencies involved in the collection and treatment of wastewater, and we represent a majority of the facilities that are involved in the Cal Sewers program. We are in direct partnership with the California Department of Public Health to help facilitate conversations between utilities and the Cal Sewers network. And we try to kind of bridge the gap in communications between the network at large and individual utilities. I kind of act as CASA's liaison on wastewater-based epidemiology and wastewater surveillance. We also are engaged in the state legislature on issues that involve wastewater-based epidemiology. So currently there's a bill that we're working on to codify the program, because currently it just kind of exists under CDPH without any statutory language. So we're trying to create that so that way, regardless of what happens at the federal government, there will still be a home for the program in the state of California. So we really try to bring utilities to the table. As I'm sure a lot of you are aware, utilities often have a interesting connection with the program, because oftentimes they're not the ones that are receiving the data and thus receiving the value of what to do and how to go out and how to manage that. And my big thing is that the utilities would love to be a part of this process, to be able to see the success stories like we just saw, how that data is used and how it benefits their community, because the same as the local, public health departments or the local cities, they have a value in their community and doing their best to help the community. So having those kinds of success stories and sharing them with the utilities is incredibly valuable. In our partnership with the California Department of Public Health, we are looking to create in-person events like this, webinars, different avenues to help onboard more utilities that aren't currently involved with the program. And that's something that we would have be available for all, venues, not just California. So that's something that we are really hoping that we can continue and advance on. So I don't have any slides, but I really appreciate you all having me. I am eager to provide the wastewater sector's point of view.
Beautiful. So that's our panel. Before we jump into the questions, right? The first question I have for everyone is, what is the hardest thing you have to face as professionals when communicating wastewater data? Take a second. People in the chat, put it in the chat. Please get those big, beautiful markers in front of y'all and write it on that big piece of paper. And once you have, whatever it is, if it's getting buy-in, if it's getting someone to listen, if it's how to communicate to the public, right? Getting things approved, whatever that is. Yeah, if you have thoughts, put them in the chat. But to our panelists, right? Y'all have been doing this for a couple months, maybe years, maybe however long, right? You've been in this beautiful program for your respective things. In your, your mind, what is the biggest disconnect or hardest thing that you have to deal with? So think about that, and we'll, once we have everyone back, give you some breathing time. Yeah, if you're, please write them on the big, white page, the poster, the page, the white page on your table in the middle. Yep. Sticky notes for questions. Yeah, so the big white sheets, please write on there your biggest issue, your biggest op when it comes to communicating your wastewater data. May it be to your leadership, may it be to the public, whatever it is. And whenever you're done, just hold it up. And in the chat, I'm hoping, Spencer, you got that for me?
I'm on it.
Thank you. See, that's what I'm saying. That's why we're like playing off. Air signs and air signs. Perfect.
Ironically, like I literally recovered it as It's a horrible habit. Well, it is when out there. Yeah, it's exactly. It's You're right, it could have been worse, because the colleges, the 9th and 30th will start the small group discussion with the instructor.
Yeah, thank you.
Awesome, yeah.
Saw the
We'll
article.
have our, we wanted to give them a little bit of a break from the topic, and then we'll come back, hear their thoughts, go back.
That's a whole different layer.
Ah. Get that engagement.
They don't wanna hear that, they want you to make it.
Yeah.
I do. So you gotta come up. I'm from Texas originally. I'm from Dallas. I'm from Dallas through. I'm a Southern girl through.
New York, I like.
The album.
They didn't do that.
All right. I feel like conversations are dying down. So, who would like to shout out or even put up your poster? I saw things in the chat. What is the biggest issue you're facing? Y'all want to go ahead? I feel like you have thoughts.
I think everybody's sick of hearing me imagine.
No, we would love to hear your thoughts. What are your thoughts?
I'm a big
Internal leadership. Okay.
because I think a lot of our conversations external stakeholders, but internal biggest problem for sure.
Or like a science of like your.
I don't think my leadership really understands it. I think they try to just ignore it. For context, I'm the epidemiologist for South Carolina. It's been passed around to different departments, consumption. We have an agency split where we were with environmental, now we're just public health. I think they just want to ignore it and hope it goes away. So it's hard for me to get anything done, to get anything approved, to even be able to send out.
Oh, can we pause really? Hey everyone, if we could stop conversations really quickly. It's really hard for our online folks to hear some of the conversations. So I know South Carolina, you were talking, and I am so.
No,
If you could, yeah.
I was like looking at how.
So executive leadership, right,
Yes.
was your biggest op,
Oh, for sure.
for sure.
10%.
And I know that there was delays in reporting in the chat. That's something I saw. Spencer, anything else? that we missed?
There was also communicating how communicating to the public that normalization of the data is important. Comparing raw data is not always apples to apples comparison, and then also how to communicate or how to get more engagement with utilities to be interested in the work, and just kind of communicating the viral concentration levels, and that the sampling is twice a week sampling is sufficient to get a pulse on a community. So us virtual folks, we're over here, we're spitballing.
Right, we love that. From y'all's, so Spencer, if you want to kick us off, from your perspective, what's the biggest misconception or the biggest barrier that you see, in your opinion? Communicating.
I can think of two things. The first thing I kind of thought of is I feel like one of the biggest barriers for folks is kind of having that lack of education or lack of knowledge about why the collection and analysis of this data would be beneficial. I think a lot of people, and it's always weird, speaking at a conference like this where people are very active in this community, but us as like the representative of the utilities, we understand it very well that as soon as people flush or it goes down the drain, they never think about it again. It is gone. It is out of their homes. It is out of their lives. And so for them, they think, well, it's done. Like that was yesterday or something. Like, how is that helpful? How is any of this helpful? And so I think bridging that gap and explaining how that is helpful and how this data can help prevent outbreaks or show where treatment is needed or whatever it may be. I think that's something that is a huge barrier for us, is to just kind of make people think about what happens after they flush, make people think about where that goes. And a lot of people, they don't even know who their providers are because it's something that's paid on property tax. So they have no clue. Um, and the other thing I was thinking of is breaking down that barrier with utilities. I think oftentimes utilities are very focused on we have to complete this service, we have to provide this service to our community, and we have to do it for the most cost-effective way possible. And I think I'm obviously a huge believer and a huge supporter of this program and the benefit that it has. I think a lot of utilities would be too. It's just opening that door. And so finding the different avenues and finding the different ways to kind of get to the right person at the right time, right before budget or whatever it may be, but being able to find that opening to explain the program. And from my experience, as soon as you get that meeting where you are able to spend the 15, 20 minutes, 30 minutes explaining the program and the value, has really been able to kind of open some eyes and get people excited about it. So I think that's kind of the two things I thought of as kind of the biggest challenges from a communication standpoint.
Thank you, Spencer. Well, it's hard to follow that up, but I'm gonna throw it to Amanda because she
Yeah.
does an amazing job.
Yeah, yeah, I think all of what Spencer said is really valuable and important. Our perspective as a national network is a little bit different, right? We work closely with our both public health and utility stakeholders, but I think there's always more that we can do to engage with the local wastewater treatment plants because they are the ones who are collecting the samples 2 to 7 times a week, depending on where they are in our program. But one of the things that we have that's interesting is we have 147 sites across the country, and we've developed this wastewater categorization system, right? So it's a low, medium, high way of looking at the data that's telling you where we are now versus where we were before. And when we launched this in October of 2023, I believe, we spent a lot of time on the back end thinking through the methodology and working, and socializing it with some of our partners, California Department of Public Health, to say, hey, does this make sense to you from an epi perspective? Because we are academics, right? We don't prescribe public health action based on the data. We are showing you the data of what it is now versus the past. And I think that that's something we've had, members of the public or media reach out to us about is like, okay, what's my risk level right now? And like I just said, we're not public health, and risk is an incredibly personal thing, right? Me as a mom of an 18-month-old, before he was fully vaccinated, my risk level around going out in public or going on a plane was different before he went through all the vaccines. But me as a data analyst, maybe on the other side or without a kid or without, parents or family members who have chronic illnesses that I need to be aware of, I may operate in the world differently. So even if something is in a high category, it's like, what does high mean to you? And we try to put everything on our about page to make it very clear the methodology behind what we do. We have different ways that we calculate the high, medium, low, whether it's a seasonal pathogen or a pathogen like SARS-CoV-2 and neurovirus that are always in wastewater regardless of season, or pathogens that aren't frequently detected, like possibly measles. We're just starting that project, but Mpox, clade 1B, Seoris, clade 2 of Mpox, and hepatitis A. So we try to spell out what we can, but we constantly get questions from members of the public about this. So we've been trying to promote a lot more through social media. I think it was last year, we met with the Sick Times, which is a SARS-CoV-2 long COVID community that has a newsletter online, and we did a webinar with them. And so they submitted questions, and Allie was able to do a Q&A to kind of try to help people understand what the categories were a little bit more. And that's because they reached out to us because they were curious and their community was. And so we still get questions about it. And I know many different agencies have different ways that they calculate, whether it be a WVAL or a high, medium, low. And that's something we've been really trying to work with all of our different partners on understanding as we continue to move from season to season.
So understanding the data and communicating data to your stakeholders is pretty important. Engaging our partners is really important, like Spencer mentioned. But how do you build that trust in your communities, right? building trust is monumental, especially in the day and age that we're in. Wastewater is a new kid on the block, if we say, among all the other surveillance tools. I would love to hear, Gabriela, yours, and Amelia, y'all worked boots on the ground with these communities. In your perspective, how is building trust, or how do you build trust with them?
Building trust, I think that's very important because as local government, I mean, just government in general, people are gonna be distrustful, right? Like, oh, they're hiding things. That's the mentality of most of our community, or at least ours. So being fully transparent, I think it's really important, and showing the data in a way that the public can understand, because we can see it as epidemiologists or public health professionals, and it makes sense. But to your typical citizen, it may be very complicated data, but the way that you display dashboards, like she was saying about the high, low, like very simplified, I think that's a great way to portray it to our community. Also asking, what is it that you would like to see? Would you rather prefer a newsletter or a dashboard? And also showing, okay, before we did this intervention, the levels of this pathogen or this substance were here, and now it's here. And the community does see the difference. And even like seeing us doing those knock and talks, they're seeing that the government, their local government, is actually doing something for them. Placing the cabinets, doing like those public health actions, and for them to actually see them, because sometimes if we just talk about it, but they don't see it, they're kind of like, whoa, are you really doing something? But when they see us out and about, and also we can show them the before and after of the data, I think that's very helpful for them to see, like to have that buy-in from the community. I know one of the obstacles is buy-in from management in general. I think by showing them what this wastewater surveillance data can do for the community and show them how it can improve by taking these actions, I think that way it will have more of a buy-in, because, okay, if we implement this program in our public health, this might happen. So putting those scenarios and simplifying even for our city management, I think it's been very beneficial to us, because not all of them are very, I guess, have the knowledge like public health does. I mean, we are fortunate that 2 of our city council members are medical doctors, so that helps a lot. But in cases that your community does not have that, I think by, selling it to them about what can be improved in the community, I think will be great. I think one hurdle that we personally struggle with a lot is our utilities partners. I know it's still under the city of Laredo, but sometimes we don't see eye to eye. And we personally don't test in-house in our laboratory, but we do partner with them at some point to collect these samples, and that's been our struggle, not really our city management, because like I said, by explaining to them the benefits of the program, they're all for it. And also having the buy-in from the community about seeing us, but utilities has been our struggle. So if anybody has any ideas on that, I'll be grateful. But yeah, I think being fully transparent and showing what public health is doing will improve a lot.
Yeah, and I'm happy to connect with you on utility coordination as well. We should talk about that. I kind of wanted to go into the relationship that, as a coordinator, I work with a lot with academic partners and other members of academia, and the difference when it comes to that audience versus the public. And I often interact with both audiences, and I think it's a very interesting gap, because you have one group that's very hyper-focused on a specific area in wastewater, and you have the public who may be familiar with the dashboard, but maybe just don't have as deep as general knowledge. So I think their interactions between those communities can be very interesting, and kind of being the person in the middle for that. Oftentimes, I'll just give you like an anecdote that there was a specific sampler that was supposed to be used and going to be implemented, and a lot of work was put behind it by the academic institution. And upon seeing it, I'm like, this is not going to work in the real world. This is going to fall apart at the utility, and it's just not available, not accessible for utility workers, and it's just not going to work into their workflow. And that kind of like disconnect, that like, well, yes, it was a great idea on paper, but no consideration was provided for the utility workers, who are the ones who are taking on that work, along with all the other work that they do. That's a big disconnect that needs to be addressed. And I think that is also applicable when coming from like a government entity, and you're saying, oh, let me go and figure this out for you, rather than being community led, because a lot of times communities have the answers to their issues, or know at least more than you do when it comes to like the solutions to the problems. A lot of times they just need an obstacle removed. And I think that is a position for like bigger entities like government to be able to go in and provide like, okay, let me run the test for you, or let me provide the data storage for you. Something like that to, but it's still community led. I think it's a difference between being like, I know it better, let me tell you what to do, let me guide you, wastewater program brought to you by this, and brought to you by this government entity, rather than the community itself and focus on the community. So and that can extend to several different communication components, like even to like language, like what kind of language should we use, and the disconnect between, I don't know if I'm the only person who's heard this, but there's a lot of disagreement with the word surveillance. And a lot of members in the scientific community and academia saying surveillance, like that's the word, that's what we do. And we just need to educate the public. And kind of a silly analogy, but like you can you can tell me all you want about a spider that's completely not harmless, but I'm still gonna pause when I see it. You know what I mean? Even though I know all that thing behind it. So just saying, oh, we're just gonna educate the public on that word. They know what the word means, but it has historical implications that we need to acknowledge. And I think that's an important perspective that we need to take into account. And it's not my soapbox for the word surveillance or against the word surveillance, but it's just like an example when it comes to how the community feels about this, and just like a barrier that can be taken down, rather than staying stuck in that, being like, no, this is what we want surveillance to mean. But again, big on being community led, and I think, and that's where my argument for incorporating indigenous research methodologies comes in, is that we need to incorporate that more in science. And this is me coming from a scientific background as well, to actually create products, to create initiatives, programs that actually work for the public and are sustainable.
Yeah, so I know that we are a little pressed for time.
10 minutes, if you
Oh.
want to keep going.
Yeah, we can keep going, but we want to open it up to y'all. I know there are questions being written down, as well as thoughts being written down. So does anyone have questions for anyone on the panel?
There are questions online.
Oh, yeah, please, online question. I cannot see the chat.
I like.
Okay, so we have, roll back up here. We have a question from Ryan Hollingshead from Delaware Public Health. How do we get more engagement from utilities to be interested in this kind of work, offering continued education for wastewater licenses, samples, et cetera? What are some of the options that
And can folks online hear us from back here?
Yeah, okay,
Yes.
okay, awesome, thanks for confirming.
I can speak to that a little bit. So our program has a wastewater surveillance coordinator who specifically works with utilities, and has a very personal relationship with them, even though to the point like, oh, this utility likes to speak on the phone rather than email. And again, that's the important aspect of relationship and meeting them where they're at. We also have had, for example, Utility Appreciation Week, which is recognized by the Colorado state government. And honestly, even just, this is a proclamation that comes down to the government, you get a certificate signed by the governor, and they get this, and again, this is a whole social media post and everything, but a lot of utilities have expressed their appreciation for actually being acknowledged. And I think it's important to note also that utility workers, they are public health, like water quality, that's like the pillar of modern civilization, right? Like, so that's the OG public health. So I think recognizing them as that, is really important. And it's appreciated, honestly. So yeah, just like a lot of relationship building, site visits, going to their site and learning about their sites, learning about their challenges, learning about what they're doing, figuring out how you can help. I think again, like, just spending time, and our coordinator does a wonderful job at all of that. So again, just spending time and building those relationships.
Hi, I'm Amy from Verily. I've spent a bunch of time at conferences this year, at utility conferences this year. And one of the things that I learned that was super surprising is that utilities are under a lot of pressure around ratepayers. So like they're increasing the rates of how much it costs for you to have your wastewater cleaned and to get drinking water. And one of the most interesting things I heard was that they need information and they need stories about what they're doing to add to their communities. It's not the people that are doing the collection that want that information, it's the PR departments, it's the general managers of the plants that are constantly looking for ways to say like, look, we're a member of your community, yes, we're charging you money, but here are a lot of good things that we can do. And I wonder if we could, as a industry group, whatever we are, whatever interest group we are, do a better job of trying to provide information to those utilities that are our partners to say, here's how you can talk to your customers about what you're doing and how that's adding value, and give it to them in a way that's already digested so that they then we're solving a problem for them, because we're still constantly asking them to do something that is solving a problem for us. But this is a problem. And Spencer, I wonder if that's something that resonates with like what you've heard or the WEF team, things that you guys have heard from your utility partners that you know more.
Well, I can speak to part of this. We started a scholarship program to bring PIOs, like public information officers from utilities, to WEF Tech so they can talk to experts, go to technical sessions, et cetera, because I come from a slightly different track, but a lot of comms people just have communications background, no science, no engineering, nothing. So they're putting information out there and don't have a background for it. If somebody came with a list, like Amy said, of here's some talking points, here's some ways you're serving the community. We always talk about frontline wastewater operators are protecting public health and the environment. And we frame it that way for a reason. So the more information we can get from you to help spread that message in an accurate way also helps them build capital with their stakeholders, because then when they have an overflow, a leak, whatever, they build positive relationships with people who will cut them a heck of a lot more slack when something goes wrong.
Yeah, and I can touch on that a bit too. You're completely right. I think that's been kind of one of my big pushing points is, you know, we are ultimately, as the utilities, like we're the ones that provide the data. And a lot of times, as soon as that data leaves our hands, we kind of don't know what happens to it. And so sharing those success stories with us is incredibly valuable, because we then can turn and point to our ratepayers and say, this is what our work has done to benefit the community. This is how we, you know, and it goes exactly to what someone previously just said about how at the base, you know, wastewater providers are working towards the community. We're trying to, you know, take PFAS out of, you know, drinking water, or, you know, take other emerging contaminants out of, you know, the environment. We ultimately our goal is to help clean the waste stream. And so having this other avenue to help our community is incredibly valuable, and having that communications, because oftentimes, you know, a bigger city or, you know, wastewater provider will have a comms team. And so they are eager for this kind of information, and they're eager to collaborate with you on these things, do joint press releases and this and that. So it's something that I think is a really big opportunity to kind of get more involved. And it, oftentimes, as many things do, it just boils down to making the right connection with the right person. But I know a lot of utilities would be very, you know, happy to be involved in those success stories.
Just have a comment, Jennifer Deegan with UT Houston /TEFI, and one of the things that we've had some success with, and we still struggle with engaging utility partners like everyone else, but early on, we had a relationship with El Paso Water, and the CEO of El Paso Water became part of our leadership team and did a lot of outreach to his colleagues at other utilities. We learned early on that public health and academia and utilities all kind of speak different languages, so having someone advocating for us who spoke the language of utilities was really helpful. And one of his pieces of advice to us that has worked really well, and in the interest of not making or letting the perfect be the enemy of the good, we only collect once a week for a number of reasons. But one of the things we've done at his suggestion is piggyback on, wastewater utilities are already collecting samples for all sorts of reasons, for the EPA, for other entities. And so we piggyback on that rather than creating a whole other system, and that's been successful for us. And most recently, during the measles outbreak, we had the utilities reaching out to us and saying, we want to add more sites because of this, and you guys have made this so easy that you're easy to partner with. It's really not extra work. So we still have a lot of work to go. We have utilities we'd love to add. We've got public health advocates who are excited about it in the community, and then utilities that are not so excited, but that's something that's workable for us.
Yes.
We have another question online from John Person from CDC News. So it's somewhat perspective, but all panelists can answer the question. It's kind of looking at a CDC national scale question. So what, from the panelist perspective, could CDC News be doing better that would meet the needs of state, local, tribal, and territorial implementers of wastewater surveillance? So what are your suggestions? What would you say is easily actionable?
So one item that I responded early online, but my response to that was one of the bigger hurdles in my view is for a lot of the smaller wastewater providers, they just don't have the staff time to do that sampling. And like others have said here, whether that's adapting to their regulatory compliance sampling schedule, or if that is, offering a grant for certain size utilities to pay for outside, an outside consultant to come and do that sampling. I think often that is an issue. And I think too, what Charmaine said in the chat here is courier and shipping costs from the treatment plant to the laboratories can also be a hurdle. So finding a way to help bridge those is oftentimes there's a desire to be involved in the program, but as you know from dealing with bureaucratic utilities, is that the small items are what really become the big issues. So I think those, and there's already been kind of discussions today of, okay, jump on their regulatory compliance schedule, adjust your sampling plan to that sampling plan and other things like that. And being involved with who their lab is and helping that be the gateway into those discussions. I think all of those are incredibly great ways to overcome those hurdles.
This is so good.
I've been granted 5 more minutes, so if we have other questions, Marlene.
I just wanted to add one thing, because I think this point that Amy raised about the utilities and supporting the communication about what they're doing is so important. We have like a stories page on our website, so that has a bunch of we've asked at a bunch of our WastewaterSCAN meetings, utilities, if you're excited, we literally will have work with you to get good footage of your utility and get pictures and really demonstrate what you're doing, and then how that connects to all these actions that everybody's talking about and the communication that goes out. So we have some stories that are on there, and we post those on social media and stuff regularly. But we're not sort of actively producing those right now, but we can do more of that in the future, and we'd like to. So if you have utilities or partners who are interested in doing that, talk to Amanda, talk to me, talk to Allie. And we also create these toolkits for partners, and they're kind of focused towards public health partners right now, but I think we could create more assets that are useful for utility partners if they want to just get a boost to have something to start with to post it on social media, just like a little easier than starting from scratch for us to be able to share, like, here's what we're doing, and if you want to boost that by posting this on your social media channels or to your community or posting flyers or going door to door, right?
Yeah.
Like, I think we have a lot of those things, and we are really hoping to do more and more work on pushing those out and like getting those in people's hands now that we have another 18 months of funding to do this. So that's my little PSA, like reach out, because I think it's exciting to hear that there's like all this appetite for that.
I mean, and just to add on to that, I think that's very important, including them in success stories. It's something that we have not done personally, because to be honest, the only time that we hear about utilities is something negative. Like, oh, it's a water boil notice or something bad about them, but bringing them in the positive spotlight, I think would work. Something that we've done too, just because of shortages in staff from the utilities, what we've been doing is that our partners will collect the water, but then our EPI team goes and picks up those samples, and our public health lab is the one that packages and ships them. So we've taken off that little bit of work from them by, helping them out. So.
We're not all
And-
negative.
Yeah, no,
Right.
And then
We
go
swear
based on
we
their
want to be part of the
standards.
positive stories, okay?
Yes, no, we're gonna put more positive things. Definitely.
Well, I grew up with a business dad, and he said, any kind of PR is good PR, because at least they're talking about you. But good PR is the best type of PR.
Yes.
With that, we would love to thank all of our panelists. If there are any questions, please feel free to reach out to them directly. But thank you guys.